Too much to study, too much to retain. How should I go about it? What should be my revision plans? What are the important things to read? What I should leave? What should be my approach to the image-based questions? And many other questions which keeps on hovering our brain when it comes to subject like anatomy. Myself, Dr. Ashwini Kumar, and today in this video I'll be talking about the approach and the methodology one should take for the subject of human anatomy. In this video, guys, I'll be talking about the weightage and the important topics of the anatomy for all the examination. We'll also talk about that what is the correct way of making the notes. We'll also see that what are the effective revision plans that we can have so that we can retain the subject for the longest and we can get the maximum benefit out of it. We'll also look into adding the new stuff to the notes, because I'm sure that people watching this video also belong to the cadre where we are coming from the third year or second year or even the final year. So they always have this apprehension whether to make new notes the next year or to add something from the guidebook. So we'll also talk about that part a bit. This video will also include a discussion on the image-based question, especially the AIMS, which is asking a lot of image-based questions. Image-based question is not a new thing now, but we need to know that what should be our approach in the anatomy for the images. We'll also look into the new AIMS pattern, how this is going to affect the subject like anatomy, and what we can expect from it. And finally, I'll also make an announcement regarding a scholarship test which I'm going to conduct in the month of July. We'll start with the weightage of the subject. It's not exactly the way it looks like. If the needs is up, like 17 questions is asked from the anatomy, which is around 6% of the total paper, the 17 doesn't always mean 17. There are overlapping questions of the ophtha, ENT, surgery, radio. So this number can go up to like 25 or 26. You are having a sound knowledge of anatomy, you will be able to answer at least few questions, maybe in radiology and ENT and other subjects which have a direct correlation with the anat. AIMS is one exam which is asking anatomy heavily. Around like 8% of the total paper is from the anatomy itself, and a lot of image-based questions, and the new AIMS pattern has again changed the way we look at the subject of anatomy. PGI exam, on the other hand, if you look at the direct number of questions from the anatomy in PGI are not as many as in other exams, but we know that PGI is one exam having 5 options and all 5 could be correct. So you don't know how many correct answers are there in those 6 or 7 questions. So you might have only 6 right answers from the total 6 questions, but you may have as much as 30 right answers from those 6 questions. So looking at only 6 questions coming from the anatomy will never tell you that exactly how much weightage anatomy is holding in the exam like PGI. And finally, JIPMER exam, again the anatomy is asked quite a lot. A lot of clinical anatomy is asked in this JIPMER exam. So again, almost 15 questions, around 6% of the total paper accounts for the human anatomy. So looking at this weightage, we cannot say that anatomy is not a kind of subject you can afford to leave. In fact, there is no subject out of 19 you can afford to leave and go to the entrance examination. I've seen people saying that if you are not good at a subject, you just consider that you have to read 18 subjects and leave the one which you're not good at. No, that's not the case. In current scenario, when the percentile is so high, when the people are scoring such good marks, people are tempted to attempt almost 100% of paper. You cannot just leave any subject at all. You need to know at least the important parts of it, if not everything about it, and that if not knowing that subject will definitely dent your rank in the entrance examination. Well, talking about the important topics in anatomy, you can never pinpoint that what other questions will be asked in the exam or what are the topics to be asked in the exam, but there's always a trend. When you look at the last 15-20 years, you will find that there are certain topics which are supposed to be important and there are questions asked from it, and there is a reason behind it. Like if I start with general anatomy, in the general anatomy and histology part, I would say that looking at the current scenario, the last 2-3 years, the one question which is asked repeatedly in the exam is about the muscles. So it's my suggestion to you that read about muscles, what type of fibers we have in the muscle, the spiral fibers, or we have a cruciate type of muscle, shape of muscle like triangular muscle or trapezoid type of muscle, all that. Even histologically, a lot of questions on the electron microscopy of the cardiac muscle and the skeletal muscle are also being asked. So the muscle, looking at the current scenario, muscle is one important topic from the general anatomy. Also, the topics which have always been important, you take the paper of last, even like 1990s, you'll find these questions are asked always, like types of joint, epiphysis, blood supply of a long bone. You just cannot afford to miss these topics from the general part. In histology, again, I cannot expect you to read everything in the histology. It's a complete different science altogether. It's a huge subject separately. In histology, lining epithelium has always been important. I mean, there was a time when they used to ask lining epithelium only. Although the questions have become more advanced now, it's not only the lining epithelium they're asking, but whatever they're asking nowadays is also from the general histology. Well, I would suggest you to stress more on the general histology rather than the systemic histology. The general histology, like the cartilages, the types of lymphoid. Lymphoid, I would say, probably the most important. The types of collagen fibers, the junctional complexes. So these are the topics that you must do from the general histology part. So this is about the general anatomy and the histology. Moving on. Now, second major unit, that is head, neck and face. Let me start with the head, neck and face here. Cranial nerves. Cranial nerves, cranial nuclei, parasympathetic ganglion. If you have a sound knowledge of cranial nerves, well, I can say that 50% of your head and neck is covered then and there only. Within the cranial nerve, you will obviously talk about the parasympathetic ganglion. We'll also come to know about the secretomotor fibers of all the glands. We'll also come to know about the taste sensation, all different type of sensation coming from the somatic structures and from the viscera. So cranial nerve, it holds the major chunk in the head and neck, and you have to be very good at cranial nerves if you want to have a good concept of the head and neck. So my suggestion to you is that do whatever you want to do in the head and neck, but don't leave the cranial nerves and cranial nerve nuclei. It's not only for the questions, it's also for the understanding of the subject, and also to make the neuroanatomy stronger, you need to know about the cranial nerves. Second thing, the deep cervical fascia, quite a hot topic nowadays. Deep cervical fascia, the questions on the danger space, the identification of the nerve. In the recently conducted AIIMS exam, there was a question on the carotid sheath. So it's all about deep cervical fascia. And again, to have a good orientation of the head and neck, you need to know about the deep cervical fascia. Otherwise, you'll always have a difficulty in understanding the triangles of the neck as well. Dura mater and dural venous sinuses, especially cavernous sinus, has always been favorite question to most of the examiners, and the relations of cavernous sinus, the situation and what are the tributaries, incoming, outgoing channels. So it's the cavernous sinus is one of the most important topic I can say from the HNF part. Also, triangles of the neck. Now, see, one thing you need to understand in the triangles of neck, that it's not about the conventional questions. I don't think that it's time that people are asking questions like what is the content of the carotid triangle or the boundary of the digastric triangle. It's more about the continuity of the structures. If you know about carotid triangle and you don't know nothing about the posterior triangle, that's not going to work out. Either you do all the triangles of neck or just leave this topic completely if you don't have time. Triangles of neck is a kind of, you get a kind of questions from the triangles when you will not see it as a question from the triangles, but it is about the continuity of the structures which are traveling from one triangle to another. Let me throw some examples to you. The questions like spinal accessory nerve is a content of which triangle of neck. So you need to know that which triangle it starts in, which triangle it goes, like carotid, and where it ends, like in posterior triangle. Similarly, a question asked in the AIIMS exam about hypoglossal nerve is a content of which triangle. Now it's not a content of only one triangle. It comes from digastric, it comes to carotid, goes back into the digastric triangle. So again, saying that knowing one triangle of neck probably will not work out. We need to know about all the triangles of neck, and you don't have to go into the extreme detail of those triangles. You need to know that what major structures, the major cranial nerves, which major blood vessels are present in those triangles, and once they cross that triangle, which other triangle they're going into. So the triangles of neck, and once again, make sure that you read the triangles of neck once you're done with the cranial nerves, blood vessels and the deep cervical fascia. Otherwise, you'll just end up mugging up the triangles. You'll never understand it. You need to have a sound knowledge of the nerves and blood vessels to understand the triangles of neck. Followed by that, one topic which is, I'm sure that if you are reading question bank, you must be aware of it, asked over and over again, is the muscles of mastication. And for some reason, lateral pterygoid muscle has been very a favorite muscle for the examiner. This question is asked like 3 times in a different exam, and they just keep giving the sections of the mandible, the transverse section, the coronal section. Recently in the NEET exam, they gave actually a coronal section, but the muscle asked was temporalis. So overall, you need to know about the muscles of mastication. And see, how will you know about the muscle of mastication? Just not the function of those muscles. You need to identify them in the different sections. So your first job is to understand the attachment of the muscles on the mandible. So in the osteology part in the head and neck, it's not only the cranial cavity and the foramina which are important, which are definitely important. You also need to know about the mandible, both the surface, outer and the inner surface, and please understand that what are the muscles attached. Those in the insertion of all the muscle of mastication is extremely important. Also in the HNF part, the pharynx and larynx, see, these are the topics which are like overlapping with the ENT and the ophtha. But I would say that in the larynx and pharynx, in the anatomy part, your responsibility is to read about the muscles. The laryngeal muscle, again, it's a very important image-based question on the laryngeal muscles, and also the pharynx, the constrictors, the structures passing between the constrictors. And there are so many questions related to constrictors, like about the Zenkel's diverticulum, the question about the Passavant's ridge, and what are the things which are what are nerves and blood vessels which are running between the constrictor muscles, the sinus of Mogagni. So if not everything, at least make sure to read the muscles of the larynx and muscles of the pharynx. Maybe not their attachment, but at least you should be able to identify them on a picture, and you should know the function of those muscles. Another heavily asked topic in the entrance examination nowadays is neuroanatomy, and especially when you see the questions in NIMHANS and the AIMS exam, the neuroanatomy is a predominant part. Well, in the neuroanatomy, I would say the first thing that you should know about is the sections of the brain: transverse, coronal, and the sagittal section. It's like inevitable that you'll get at least one question on the section, and you may not be asked to identify the structure, but the question actually begins after you identify the structure. Like recently in the AIMS exam, they put a arrow on the fornix, and the question was that the following fibers begins where. So the first thing is to identify the fornix in the coronal section. So make sure that you identify the sections of the brain, the transverse, coronal, sagittal, all the three sections, which will help you in the radiology part as well. So sectional anatomy is extremely important, and as I said, the questions are based on the identification of the structures, and even the ventricles part can be covered if you know the sectional anatomy. Second thing, I would say the tracts. Now, once again, to have a better understanding of the brainstem syndromes or brainstem lesions and even the spinal cord lesions, you need to know about the tracts. Just trace the tracts, know about what lemniscus the tracts are forming, where they are decussating, and which specific thalamic nuclei they are ending into, whether it's VPL nucleus or VPM nucleus. So that part is also important. It's not that we just look at the transverse section of the spinal cord and we see, okay, this is a spinothalamic tract, the function is to carry the pain and temperature, and that is all. No, that's not going to help. You need to know about that tract is traveling into the brainstem, what lemniscus is formed by it, what is the situation of that lemniscus, in which syndrome the lemniscus will be involved, what are the output, will it be ipsilateral or contralateral effect, and then only you can move on to the topic like brainstem. So I would say that brainstem injuries and the brainstem lesion, it heavily depends upon the understanding of those lesions. It heavily depends on the spinal cord. If you don't know the tracts at the level of spinal cord, then you will never understand the brainstem completely. So start with the spinal cord, understand the tracts, then go to the brainstem, read about brainstem nuclei. The important part will like auditory pathway, which is repeatedly asked over and over again. Recently conducted AIMS, they asked this auditory pathway to arrange them in a sequence. And then move on to the syndrome part of the brainstem, which I'm sure will be done in the medicine also. But once you have a sound knowledge of the syndromes in the anatomy part, you will enjoy that part when we'll discuss in the medicine. In the cerebellum being a small topic, so you need not worry much about it. It will not take much time to read the cerebellum, especially the cerebellar peduncles. I'm not saying that gray matter of cerebellum is not important. The histology of the cerebellar cortex is important as well. But the cerebellar peduncle, the three peduncles and what are the tracts passing through those peduncle makes it very important. And please remember that because we have to do MCQs and we have three cerebellar peduncles, so you don't have to read all the three cerebellar peduncle. Just have a good hold on any two peduncles and you can always do the question by the method of elimination. You need to just shed off your workload. So three peduncles and reading all the tracts from every peduncle will be a bit, painstaking. So it's better you read the two peduncle, the one which are having the least number of tracts inside, and just leave the rest of the tract are obviously going from the third peduncle. That's the way to go about the cerebellum. After cerebellum, the cerebral areas and the homunculus. Well, there was a time when this topic was not very important. There were very specific areas to be asked in the exam, like Broca's area or the Wernicke's area. But because of the introduction of all these image-based questions, suddenly this topic has become extremely important. And they might give you a section of the brain, the superolateral surface or medial surface, and they can put an arrow anywhere. They will ask you what is the blood supply, what is the function of that area. So all the not extreme detail of it, but you should know what are the important areas present, in which region, in which lobe they are present, and what is the dominant blood supply of that region. You need to know about the sensory and motor homunculus also, because they are clinical questions which are framed in such a way that just knowing the areas of the brain will not work. You need to know that which part of the body they are actually representing. So homunculus, that picture of the homunculus, the coronal section of the brain, and you see that the homunculus which is shown for the sensory and motor homunculus is extremely important. In the neuroanatomy, if I have to, let's say, suggest only one topic, I mean, I would say that the most important topic in the neuroanatomy, I would say, is definitely the white matter of the cerebrum. The internal capsule, the corpus callosum, the fornix, all these white matter of the cerebrum has always been an important topic, and when you will pick up the question bank, you will see that maximum questions in the neuroanatomy are usually focused on these topics. So don't miss anything in the white matter of the cerebrum, the association, the commissural fiber and the projection fiber. The more you read about it, the more understanding you will have for the neuroanat, which will, I'm pretty sure that will help you in the other subjects as well. Blood supply of the brain, yes, obviously the blood supply has to be done. You need to know about the branches of the major arteries like internal carotid, the arteries contributing to the circle of Willis, the branches of basilar artery or vertebral artery, along with some variations. And specifically the blood supply to internal capsule is very important. As we know that coronary artery is condensing and forming the internal capsule. So we have all the major tracts compressed or condensed at one particular region. And that's why the blood supply becomes very important, because involvement of the blood vessels supplying the internal capsule will have a widespread effect. And that's why this has always been an important topic in the anatomy, to know about the blood supply of internal capsule. The third major unit is the embryology. Well, I always believe that embryology is one of the most make and break kind of topic in the human anatomy, because people are kind of scared topic. Although if you are good at general embryology, I'm pretty sure that you will really enjoy the systemic embryology part. People who attended my class, I presume that they probably found embryology probably one of the most interesting thing, because it's very conceptual, it's very mathematical. It's like 1 + 1 = 2 only. So you have to have a good concept for the general embryology, and general embryology is something which is heavily asked. Most of the central institute, they are more in asking the question from the general embryology rather than systemic embryology. So general embryo, the more you read it, actually it's good for you, and it will also help you understand many other things. I mean, there are so many syndromes, there are so many anomalies that we need to understand in the different subjects like pediatrics and surgery, and because we don't know the embryology part, so probably we end up mugging out. So just read the general embryology part, especially the gastrulation and neurulation process, and you will find that there are a lot of questions asked in the previous exams from it. Neural crest cell derivative, the fourth germ layer, the so-called fourth germ layer, neural crest cells derivative has always been an important topic, not only for the PG entrance examination but for the researchers also. This is this topic which, it's a very dynamic topic. It keeps on changing. What are the derivatives of neural crest cells? What are the derivatives of the mesenchyme derived from the neural crest cells? So make sure you go through the neural crest cells derivatives. Pharyngeal arches, well, if people are aware of what are the questions asked in the previous 2-3 years, you will see that pharyngeal arch derivatives is one topic which is repeatedly asked in the NEET exam as well as in the AIIMS exam. And the development of tongue. Tongue anyways is an important topic, so development of tongue is also very important, and it's very logical also. Once you understand about the pharyngeal arches, you will see that development of tongue, it opens your mind that how exactly tongue develops, that what is the lining epithelium of the tongue, why that lining epithelium is present there, and the reason behind the different type of innervation the tongue is having, which is also coming from the understanding the embryology part of it. After that, in the cardiovascular system, the CVS, I know that in the embryology, the people are most scared of this part, the CVS, the development of arteries and veins. But again, if you know the general part, if you know how to begin with, if you know about the heart tube, if you understand the sinus venosus and the truncus arteriosus formation, what are the primitive veins present, know about the vitelline veins, umbilical veins and cardinal veins, and then you will start with this venous anatomy and the the arterial anatomy, you will not find it difficult. It's just that you need to start from a properly, you need to start from the general part of the cardiovascular and then move on to it. If you directly try to read the development of arteries and veins, you will never understand this. So you have to be very sequential in this topic. Unlike other topics in the gross anatomy where you can start even from the middle of it, you can understand it. But embryology, it has to start from the general and then you have to move on to the systemic part. Then the diaphragm, whether it's the gross anatomy, it's the clinical implication, it's the or the embryology of it, everything about diaphragm is important. So diaphragm is one topic you just cannot afford to miss anything out of it. So it's all important in the diaphragm. In the GIT, guys, GIT, again, the embryology of the GIT is not difficult at all. And especially you have to understand the derivatives of the mesogastrium, the dorsal and ventral mesogastrium, and midgut. Well, midgut is one topic which will help you understand so many different anomalies that you did in surgery also. The malrotation, the reverse rotation. So just make sure to read the midgut, understand all those gut rotations, what is the result of every rotation, and then only you can understand the anomaly. If you directly try to read the anomaly, the non-rotation or malrotation, you will not understand it. You probably will end up mugging up all these anomalies. Just look at the normal embryology, that how exactly this rotation takes place, and then when you move on to the anomalies, you'll find it's extremely interesting and very, very fruitful also. In the urogenital system, again, the derivatives of, especially the derivatives of mesonephric duct and paramesonephric duct, the derivatives and the remnants, this is one topic where you get a lot of questions from. And something that you read while discussing the neuroanatomy only, there are the brain vesicles, the derivatives of the prosencephalon, mesencephalon and rhombencephalon. So all those derivatives, that what they give rise to, and even the development of the ventricles, that cavity of which brain vesicle forms watch ventricle is also important. So that's about the embryology part. These are the important topics that you must read. And the embryology, again, it's a big unit. Again, we cannot expect to read everything in the embryology. I cannot expect you to read the molecular regulation of everything. You might get one or two questions in 4 or 5 years. Once there was a question on the molecular regulation, so just don't bother about it. You cannot change the course of your preparation based on one weird question asked in the exam. Moving on to the thorax. Well, when it comes to thorax and limbs, well, this is, I always say in my class also, that these are the topics which we usually neglect. We are so much into the head and neck and neuroanatomy part, and rightly so, because we got a lot of questions asked from those topics. But you will get a question from the thorax and limbs also. And we are, as I said, we are so much into those topics that we end up neglecting these topics. We just read very few things from the thorax and the limbs, and sometimes the examiner may surprise you. Like, look at again recent AIMS question. There was a question asked from the thorax also, and they just gave a picture of a ventricle in which the different structures was marked, and you got to identify them. So it was a simple identification question, but at least you should have read it once, then only you could answer it. In the thorax and abdo, when it comes to viscera, well, what I believe is that the walls becomes very important. You need to know about the thoracic wall and the abdominal wall. See all the procedures like pleural tapping, the intercostal injections, when you got to reduce some hernia, so you need to know about the inguinal canal. So the wall part is extremely important. Surgical approach to the kidney, what structures to be damaged. So make sure that you read the thoracic wall as well as abdominal wall very well. In the thoracic wall, the inlet and the outlet of the thorax also is to be read. There's a lot of question asked on this suprapleural membrane, and outlet of the thorax, is the diaphragm, which I already said, it's one of the most important topic. Secondly, the pleura and pericardial recesses. What is the most dependent site of the pleural cavity? What are the pericardial recesses or sinuses we got, and what are the advantage of those sinuses? So you got to read about the pleural recesses, the pericardial recesses, and the sinuses also. Bronchopulmonary segment, the two main viscera, that is the lung and the heart and the thorax. So in the lungs, that bronchopulmonary segment is probably the most important, because it's clinically very important. You need to know that what are the most dependent areas, which segments might be absent, which segments might be fused, how many number of segments in the right lung and left lung. So all that is again important part. In the heart, interior of the atrium and ventricle, well, you need to know about the exterior also. Look at the question recently asked. It is about the surface marking of the right atrium. And I have always believed that you need to know about the exterior of the structure before you go into the interior, because that actually makes a good orientation. And looking at the new AIMS pattern, The video based question are also introduced. So I believe that the surface marking is going to become one additional topic that we all might have to read, especially the thoracic surface marking, and all the major nerves and vessels surface marking in the upper and the lower limb as well. So interior of the right atrium and right ventricle, at least you should read that part. Coronary circulation, well, needless to say that how important coronary circulation is at every front. So the coronary arteries, their variations, about the coronary sinus, the tributaries of the coronary sinus, what arteries are running with those tributaries of coronary sinus, the blood supply to the conduction system of heart. So again, overall, everything in the coronary circulation is important. Then we have the posterior mediastinum structures. See, let me put it this way, rather than saying the structures in the thoracic wall, the structures in the posterior mediastinum, azygous and hemiazygous vein. Again, a recently asked question in the NEET exam. The question on the branches of the descending aorta. The questions on the thoracic duct, always been an important question. At what level it deviates to the left side? What are the tributaries of thoracic duct? What are the regions drained by the thoracic duct? Different levels where it is formed, how it enters the thoracic wall, level of deviation, till which cervical vertebrate reaches. So again, it's a very small topic, but a repeatedly asked topic here. Esophagus. And do understand one thing, esophagus, thoracic duct, ureter. Now these structures, most of them which are the tubular structures and running from one region to another region, they automatically becomes important because they have a different type of blood supply, different type of nerve supply from different region. Like esophagus is having a cervical part, we have a thoracic and the abdominal part also. So we have a blood supply coming from all the three different regions. We have a lymphatic drainage, we have a venous drainage differently present in the cervical, thoracic and the abdominal part. So all these structures which are running from one region to another region, their blood supply and their lymphatic drainage automatically becomes important. So make sure to read about the esophagus and the thoracic duct, as I said, the ureter, the blood supply of the ureter, the relations of the ureter, that is also important. So in the thorax, all this, these are the topics that you should go through. And it's a small unit, it will not take much time. If you just, even if you're reading the thorax for the first time, it should not take more than 6 or 7 hours to finish off the entire thorax. Coming to the limbs part, in the upper limb, the first and probably one of the most important topic in the upper limb is the shoulder and the scapular region. Well, shoulder, scapular and axillary region, just try to read everything about it, because the muscles which are present here are important. The brachial plexus, axillary arterial branches, the scapular anastomosis. So this somehow this axillary region, the pectoral region, and the different type of image-based question can also be asked from it. Again, 2 years back there was a question asked in the AIMS in which they gave a transverse section of the axilla and you got to identify the structures in it. So you need to have a very sound knowledge of the shoulder and the scapular region. Then when it comes to the muscles, I mean, this is one question which I've been asked very frequently, that what muscles to read. There's so many muscles in the upper limb and lower limb, and we cannot sit and read the origin insertion of all the muscles. So which muscle we need to pay attention to? Well, proximal end of the long bone is providing, most of the time it provides insertion to some muscle only. Like if you look at the proximal end of the humerus, the greater tubercle, lesser tubercle, that's an insertion point for the most of the, it is the insertion point for the muscles here. Look at the radial tuberosity and the ulnar tuberosity, insertion of the biceps and the brachialis muscle. The same goes with the tibial tuberosity, the greater trochanter, the lesser trochanter, the greater trochanter, again, a recently asked question of AIMS again. So when you look at a proximal end of a long bone and the insertion, what muscle is inserted to it, I'm not talking about the origin, insertion of the muscle there, which muscle are inserted, and what is the action of that muscle is important. So you don't have to sit and read every muscle. Find out what are the proximal end of the bones are having all those traction epiphyses or those tubercles or trochanters, and what muscles are attached to them, and just go through their nerve supply and their action part. That should be enough. That should be good enough to be able to make you able to answer the questions which are asked in the different exam. Maybe it's an image-based question, or maybe a question asked directly like what are the muscles attached to these tubercles or trochanters. In the upper limb, I would say that muscles in the hand are important, and you need to know about their attachment also. You don't have to read the muscles of the hand the way we read in first year. It's not that you will read about the tubercle of scaphoid and crest of trapezium and the lateral side of base of proximal phalanx of thumb. That's not practical. You cannot, remember the muscle attachment in such a great detail. But you should know that which bones are they starting from and which bone they are ending at. That's more than enough. Just know the muscle is coming somewhere from the scaphoid bone and going to the proximal phalanx. That's fine. Because it's not the anatomy question which we are bothered about here, it's the question in the orthopedics also, which will be covered if you know the muscles of the hand and their attachment. Like the questions like in case of Bennett's fracture, which thumb movement is impaired? So you should know that what muscle is on the first metacarpal. A carpenter is having a crushing injury of the little finger, then which muscle will be spared? Now, a recently asked question was again in the aims that which finger is having the two dorsal interossei. So again, if you just know that where the muscle is starting, where the muscle is ending, that is good enough to answer it. They didn't ask you that what is the precise origin and the insertion of the muscle, but there are so many clinical questions which you will be able to answer just by knowing the location and the attachment of the muscle, and that too superficially. Don't go into the detail. Don't waste your time on the tubercle and the hook of hamate and that the crest of trapezium, all that. No, just know the name of the bones, and that's more than enough. The three nerves, needless to say, when you compare the upper limb and lower limb, especially in the upper limb, the questions on the nerve becomes very, very important. See, in the lower limb, there is not much of a differential that we have to do. Femoral nerve injuries, obturator nerve injuries, and sciatic nerve injuries are easiest to differentiate from each other. They're supplying completely different compartments. Their action is completely different. So it's never a problem in the differentiation kind of question in the lower limb. So what I'm trying to say here is that the questions on the differential diagnosis are very challenging in the upper limb as compared to the lower limb. So make sure to read all these three nerves in detail, and rather than remembering the innervation of the muscle, like you don't have to remember the name of every single muscle, that posterior interosseous nerve supplies extensor carpi radialis brevis also, this and that. You better remember the muscle with their action. The extensor of the wrist, extensor of finger, extensor of flexor of the wrist, flexor of the elbow. These group of muscles are supplied by this particular nerve, and that's how you'll be able to answer the questions. More than knowing the action of a particular muscle, know the group of a muscle and what action they are performing at a particular joint. Muscle identification in the different view. This is again the image-based question asked in the January NEET. It was 2019 only, in which they asked a question on the brachioradialis muscle. Well, still there's a confusion whether it was brachioradialis or ECRL. But what I'm saying is that in the forearm, in the thigh, and in the leg, arm muscle will not be a problem. So in the forearm, thigh, and the leg muscle, at least have a view of atlas and see that how the muscle look like, superficial group of muscles. You know the name, but you should see that which muscle is most lateral, which muscle is most medial, and that should be good enough to identify those in the exam as well. Dermatomes of the upper limb and lower limb, especially the dermatomes of the hand, which is always a topic of bit controversy also, that how much part is by the radial nerve and how much is by the ulnar nerve, especially on the dorsum. C6, C7, C8 dermatomes, exactly where they're located in the hand. So you better refer any standard text for it. I would go with the Gray's Anatomy and look at least those pictures of the dermatome of the hand, and also the dermatome of the dorsum of the foot, especially the first web space of the foot. That is again important. Next on to is the lower limb part. Lower limb, if you compare it with the upper limb, I would definitely say that the questions from the upper limb are more expected to be asked in the exam than the lower limb. But as I said, you never know. So in the lower limb, I would say the femoral and the obturator nerve, the nerve supplying the anterior and the medial compartment, their branches, their division, and what are their supply, what are their cutaneous innervation. That is also you need to know, like femoral nerve gives off the saphenous nerve, what is the course of the saphenous nerve till where it supplies. So that becomes important. In the lower limb, guys, the hip region, I mean, first I would suggest you to read the gluteal region, and once you're done with the just read the gluteal region, the muscles in the gluteal region. Make sure to read about the muscles of the hip joint. Again, the attachment and all is not very important. It's that you need to know that what are the different type of movement that takes place at the hip joint, what muscles are responsible for it, and those muscles are supplied by what nerve. I mean, they might ask you a question like that in the flexion of the hip joint, which nerve is needed, or in the extension, which nerve is needed. So not only the muscle, you should also know about the nerve supply of those group of muscles. In the knee ligaments of the knee and all, you also discuss it in the ortho part, when you talk about the different injuries of the ACL, PCL and all. but anatomically it's your responsibility to read about the intra and the extra articular structures of the knee joint, like cruciate ligaments. Are they intracapsular, are they intrasynovial, or they are extrasynovial? So all those kind of arrangement, the intercondylar area of the tibia, what are the structures there? So you might get questions on that on those regions. Also the ankle ligaments, I always believe that ligaments of ankle are very important because of the inversion injury, that which ligament will be involved. Deltoid is it's a huge ligament on the medial side of the ankle. What are the different type of fibers we have for the deltoid ligament, and what is the superficial fiber, deep fibers, attachment of the deltoid ligament. I've seen this question asked twice in the exam about the attachment of deltoid ligament. So looking at the of the questions of the past 5 to 7 years, ligament of the ankle is very important. Apart from all these topics in the lower limb, well, definitely the most important, I would say, is the arches of foot and the sole of foot. So make sure to read about especially the arches of foot and the different factors which are maintaining the arches, the slings, the summit, the keystone, what are the joints involved, what is the main ligament supporting the medial and the lateral arch. So make sure to read the arches of foot, make a table of it, and just write all the differentiating features between the medial and the lateral longitudinal arches. Then we got some structures which are spanning in the entire lower limb. The two of them, especially one is the sciatic nerve. Needless to say, you got to read the sciatic nerve, especially the common peroneal nerve, injury to the common peroneal nerve at the neck of fibula, and what are the outcomes. How will you differentiate the injuries of the common peroneal nerve and the injuries of the tibial nerve, which is not a difficult thing, but yeah, you got to read that. And also make sure to read about the great saphenous vein. Read about the formation of the great saphenous vein. Do read about the drainage, the tributaries, and especially the perforators of the great saphenous vein. What is the level for the perforators? And just like upper limb, as I already mentioned, the dermatomes of the lower limb are again important, and especially the dermatome on the dorsum of the foot, the first web space. And lastly, about the abdomen. Abdomen, it's a huge unit. Again, you cannot end up reading everything in the abdomen. You have a requisite time, and in that time you have to read the important topics in the abdomen. Just like thorax, in the abdomen the wall is very important, especially the inguinal canal, the rectus sheath, the muscles of the abdominal wall is important. If not the detailed attachment, just make sure you can identify the muscles direction in the different pictures. And even thoracolumbar fascia, that is also part of wall, I would say. So that is very important. When it comes to relations, the relation is something which most of the people are scared of, that how many of relation we can read. There's so many relations we have, like duodenum itself is having 4 parts. Do we have to read the relations of all 4 parts of the duodenum? Well, I feel that relations which are surgically important relations are important, like the posterior relations of kidney, they're surgically important. Relations of the ureter, the abdominal relation of the ureter are important, they're surgically important relations. Stomach bed, lesser sac relation. So the relations that you think that is more important from the surgical point of view, and I also give the list of that, are important, and you should read only those relations, and you should not waste your time in reading the relation of every single organ, because you cannot finish it off. Liver, I believe that this is a topic which is discussed in the surgery also, but liver segmentation, the Conrad's classification, this is something which is again a topic on trend, and they're asking loads of questions from the liver segmentations. And there was recently also in the AIMS exam, there was a question about the segmentation of the liver. So make sure to read about the liver. Blood vessels, the celiac trunk, superior and the inferior mesenteric artery, internal iliac artery. At least read the branches of all these arteries. Some one-liners you might get on this, that which of the following is a branch of this artery, not the branch of this artery, which is usually asked in the case of the internal iliac. And moreover, the arrangement of the superior and the inferior mesenteric artery in the concavity of the large intestine. What is the arc of Raylan? What is the marginal artery of Drummond? So all these you got to read. So just make sure you go through the blood vessels. And when I say blood vessel, it also includes the portocaval anastomosis, site for the portocaval anastomosis also. Peritoneum, peritoneum is a small topic. It's a topic which is very small, but it needs a lot of orientation. So you got to understand the 2 sections of the peritoneum, one transverse section at the level of the epiploic foramen, and one titled section in which you can see the greater sac and lesser sac and the extension of the lesser sac. So make sure you look at these sections from any of the standard textbook or guidebook or from your notes, and try to understand that how exactly the peritoneum is displaced vertically as well as horizontally, because this topic is all about getting oriented, and there are so many questions which you can solve based on the orientation itself. Like epiploic foramen, people keep on mugging up the relations of epiploic foramen without understanding that where exactly the epiploic foramen is. Is it beside the lesser omentum or is it behind the lesser omentum? So those kind of small things which makes a lot of difference. So make sure you read the sections first, read about the transverse section, longitudinal section, and then go into the lesser sac and the epiploic foramen or the hepatorenal pouch of Morrison or the duodenal recesses. So this is again a topic in which they keep on asking the questions repeatedly over and over again from the same topics, but if you are not oriented to it, that small topic will look huge, because you cannot mug up those sections or those relations, because there are too many. So you have to be oriented to it. Pelvic organs. In the pelvic organs, again a part which is kind of covered in the OBG part as well, but in the pelvic organ, make sure you read at least the support part. Vasculature is also important, but the supports of the pelvic organ is important, especially the supports of the uterus is very, very important. And last but definitely not the least, I've always believed that one of the most important topic in the entire human anatomy for the PGME exam point of view is perineum, and which is being proved in the last 2-3 years. AIMS asked this question twice about the pelvic diaphragm. There was a question about image-based questions 2 years back, and now in this exam also they asked the attachment of the for the levator. They asked the question on the levator ani muscle, the attachment of the levator ani muscle. So make sure to read the perineum part well, the perineal pouches, the ischiorrectal fossa also, the perineal membrane, the boundaries. So this is a topic which is repeatedly asked in all the examination. It's not only about the AIMS or the PG exam, it's a NEET or JIPMER. You take any exam, you'll find the questions asked repeatedly from the abdomen region. Now coming to notes making and the effective revision plan. When it comes to notes making, I know that most of the people nowadays think that it's a big burden that we have. We don't have time to make the notes. Well, I don't think that anything has changed from the 5 years back and now. We have the same kind of workload that was there, and it's just that probably we have gone a bit lazy and we don't want to make notes by himself. We just think that if we have a printed material in hand and we have the lectures in the mobile, we can just go through it. But you will realize maybe a bit later that that's not gonna work. Even if you are looking at an online lectures, I would still suggest you, it's always better to make your own notes. There's nothing in this world that can replace your own handwritten notes. Doesn't matter what kind of handwriting you have, what your drawing skills are, that doesn't play any role in it. So everyone will have their own opinion, but what I suggest to you is to write down by yourself, because that's incomparable, and you have more of a pictorial memory of the stuff. So make sure you make your notes colorful also. I mean, just imagine reading all the stuff in black and white and then reading the same thing in the colored. You will brain your register more colors actually, and you may not remember the labelings for the diagram, but you might remember the color, the red color for the artery, the blue for the vein. So that basically is helping you to in the retention, and the retention is the confidence. The more you can able to retain, and then more confident you'll feel about it. Imagine you read anatomy now, and after 1 month when you pick up your notes and you feel like that I don't remember anything out of it, your confidence will be like shattered, and you will start feeling bad about your preparation. So make sure that you have better retention, and the better retention is achieved by writing your own notes, and also by making them colorful and revising them time to time in between, so that when the big day comes, you're able to recall the most of the things out of your notes. Now, what exactly is a complete note? What is, when I say that how to complete your notes, what is the effective revision plan? The effective revision plan comes after you have a complete notes, and complete note means that you read the notes first. No matter whatever the source is, wherever you attended the classes, whether it's offline class or online class, you make those notes, You do the questions from a question bank, guys, and I mean it when I say do it from the question bank, not from any online application. Doesn't matter whatever online application is there. I'm not in favor of doing the question for the first time from the online application. Do it from the textbook or from any guidebook. Read those questions. I'm sure you will not be able to answer all the questions in that. Whatever question you don't know the answer to, you just check the date for those questions. If the question is asked in last 5 to 7 years and you don't know the answer to that question because it's not in the notes, please make sure add that information in your notes itself, and that will make your notes a one-stop solution. Again, I'm not against the online platform. I myself is on online platform, so I'm definitely not against it. What I'm saying is that do the questions from a guidebook, and then you switch on to any online platform. You can, once you're done with all the 19 subjects, then you can actually switch to the question bank on the online platform. These online platforms were not there 3-4 years back, and people were still getting very good ranks, very good marks, and the exam standard was never low. The exam like AIMS and PGI, if you pick up their paper 5 years back, you'll find the questions as good as they're asking the questions nowadays. So please don't start doubting your own preparation by comparing it with any of the online platform. Any of it, doesn't matter. So just go with the traditional system, notes, a guidebook, do the questions, add certain stuff to your notes, make it one-stop solution. Rest up to you, whatever you want to add it to it later on in the revision after the August or something. It's up to you. You can use it for the practice, you can use it for the extra edge, but don't make it a the access of the preparation. That will not gonna help. Testing yourself is very, very important. We have a subject-wise test, we have the grand test available, and we have these tests available offline as well as online at different platforms. And I've seen that most of the tests are very good. They're very good. So do give the subject-wise test, but make sure you give the grand test also. Now, one apprehension which I have seen in most of the students is that when they're done with only 2 or 3 subjects, they don't want to give the grand test. They think grand test should be given after completing all 19 subjects, or at least the 70 to 80% subjects should be done. Then only we'll give the grand test. Well, I believe that's the biggest mistake that anyone can do. Let's say if you're only done with anatomy, that's the first subject you're reading. Please give the grand test after 15 days, or at least in a month give one grand test, because in that grand test you will not only test the knowledge of anatomy, you'll also test the application. It's not the subjective knowledge which is being tested, it's the application of the anatomy in the other subject which is also being tested there. There are questions in the surgery and ophtha which are considered a question of surgery and ophtha and ENT and surgery and radio only, but because you have a sound knowledge of anatomy, you will be able to score well in those. Next week when you're doing physiology, you're done with physiology, fine. You might be able to do some questions from the pathology, or maybe some questions from the medicine if you're done and good in physiology. Even if you score 20% or 30% initially in the grand test, there's nothing to be ashamed of. You always got to start from somewhere. But please make sure to look at your graph, whether it's going up or is it being stagnant or is it going down. The more the subject will keep on doing, your grand test score will increase, and that is a real test. Subject-wise test will only tell you about that how good you're prepared in that particular subject, but the paper that you're going to give, the final exam that you're going to give, will have the amalgam of all 19 subjects. So please give the grand test. Usually it is recommended to give the grand test every month. I would suggest you to give a grand test every 15 days. Imagine if you give a grand test directly after 6 months. I mean, you're done with like 17 subject or 18 or maybe all 19, but then you start giving the grand test and you score even 60%, 65% in your first grand test, you will not be satisfied. You will feel, I only scored this much. This is not good enough to get a good seat in the exam. But because you are looking at the direct 60-65%, when you start your journey from that 20-25% or even 30% marks initially, and when you see yourself progressing from 30 to 35, 40%, 45%, you will feel very good about it. And when you see if I can cover a distance from the 20% to the 60%, the 80% or 85% is also possible. So please start giving grand tests right away. And every single platform that I've seen are giving very good grand test. So I don't want to name any, but whatever online as well as offline platforms which are present, they're all making very good tests, and you should go for it. Well, coming to image-based questions, now image-based question is not a new thing. The image-based question is being asked in the exam from last 4 or 5 years. So people are pretty much aware of that, what kind of questions being asked. And what you see, it's just a replica of the previous year questions only. No extra effort is needed. You don't have to read the images out of the blue. Just look at what are the questions asked in the last 4 or 5 years, what topics are asked in those 4 or 5 years, and try to look for the images for those topics only. And just don't try to read everything, and just don't try to save every image from the Google, because that will just increase your workload only. And it's virtually impossible to read all the images from atlas also. I mean, look at any atlas. If you take the most commonly used atlas in the anatomy, that is Netter's atlas, you look at one picture of the Netters, and you will see there are hundreds of labeling around it. You cannot read all those labelings. You will end up wasting lots and lots of time in it. So make sure that you have a list of what images you want to read, and that list is based on what are the questions asked in the last 4 or 5 years. So don't have to read all the images. Whatever topics theoretically are important, the same images you have to go to see in that. And as my role in it, I'll keep on continuing with the hashtag RTA_VS, that is a real-time anatomy video series. I posted few videos in that series, and thank you so much for the great response I got from those videos, and I'll keep on posting them. I'll make sure that every week after a class I have one day at home, and I'll make sure I'll keep on posting those videos, at least one video a week. And that way, by the time we reach the November AIMS or the NEET in the January, we'll be done with most of the important images, the real-time images of the anatomy. Regarding new pattern of AIMS, then what has changed? Now, let me be very frank in this, nothing. In the anatomy, nothing has changed. Again, don't put an extra effort, don't just try to overdo things and just try to read something special about this new AIMS pattern. It's the same thing. The people who attempted the recently conducted AIMS, they would have realized that at least for the subject of anatomy, this new AIMS pattern did not bother them at all in any way. The same question, you got to arrange them in a sequence, the true or false statement. The only thing I would say that in the questions like true or false statement, now the question becomes more like a PGI type of question, in which you have to read a detail of every single topic. Like with the question on the carotid sheath, they try to ask everything about the carotid sheath. What's the location of the sympathetic chain? What is the relation of ansa cervicalis? So people who read, whose readings are based on the concept, they will never ever have a problem with this new AIMS pattern. In fact, they will enjoy this new pattern, and you people can actually fetch more marks than the people who are just mugging up the subject and going for the exam. So this AIMS new pattern, for my subject, I would say will not change much. So don't be much bothered about it. Well, new grand test will be designed obviously on the basis of the new AIMS pattern. So just you need to have certain practice to attempt those kind of questions. But when it comes to the preparation, nothing new. You don't have to change the course of your preparation at all. And finally, now about one announcement which I want to make. I'm going to conduct one scholarship test. In fact, I'm going to conduct the 3 scholarship tests in 2019. The first scholarship test I'm conducting is on the 29th of July 2019, and the day is Monday, because I know that many people go for the classes on Sundays, so we kept it on the Monday, and the time will be at 10 p.m. So hopefully that most of the people are free to give the test. The test is free for everyone. It is the 70-minute test, which includes 100 questions based on new AIMS pattern and the image-based question, video-based question, everything will be there. So we'll try to cover up all important topics of the anatomy in that. And you will be provided with a detailed solution also after the test is done. I've also decided that the people, just to motivate you guys, if the people attempting this test and scoring well in the exam, the first 20 rankers will get a total scholarship of rupees 1.5 lakh from my side. The first 5 rankers will receive the scholarship of rupees 10,000 each, along with the free app subscription for 1 year. The ranks 6 to 10 will receive the scholarship of rupees 7,000 each with the subscription of app, and the next 11 to 20 rank holder for that test will receive the scholarship of rupees 5,000. So make sure you give the test, take an advantage of this scholarship test. And it's not about the scholarship only, it will be a good practice for you for the exam, because I'll make sure that I'll make the paper absolutely based on the new pattern, and every single question will be framed by me, and I'll make sure that it's not only about the NEET, AIMS, in ENHANCE, every exam kind of question which is asked in the different exam will be covered in it. So this is about all the announcement which I have to make. And if you have any queries, you can always send me your doubts and queries on the Facebook, on the YouTube. I'm sure you all have my numbers also. And just feel free to ask. Thank you so much.